Guys, welcome back to the Kevin TV. On this episode, I want us to talk about how to admit a patient. You are a nurse, you are a student nurse. You know, say you are in level 100. What do you want? Charlie, you are going to do it. You are going to do it, sister. So we are going to learn about how to admit a patient into the ward. Have you ever wondered what really happens when a patient enter, or the moment a patient enter into the ward for the first time? What are you going to do as a student nurse or a rotational nurse? Admission process is one of the most important or one of the most vital things that you need to know as a nurse, because with that you are going to give an organized care, you are going to give a competent care, and also going to be sure that everything is under control as a nurse. So let's take them one after the other. The first thing that you need to do is receiving the order from the doctor. You must know, or you must get to know, say, before the patient will come into your ward, the doctor has ordered the person to come there, or the doctor has shown the person, say, go to this place, go to here, go to here, go to here. So you need to first check. You see, say now the it's first now. Now you do everything on the computer. So before the patient will be placed into maybe the surgical ward or under the emergency ward, the patient already you will see it on the PC before answering why you approve, and then the patient will be brought into the. So first one, you need to receive the order from the doctor. So you need to check and see. Then after that one, you need to check the type of admission or the admission type. You need to know whether the patient is going to the emergency, whether the patient condition or the emergency, whether the patient is going to the surgical ward, or you need to also get to know the patient is going to maybe the medical ward. After you've known this one, you need to prepare the unit. Under the preparation of the unit, one, you need to make sure you make bed. Prepare a bed for the patient. Then the bed now be making, make sure all the necessary things that you are going to use to care for the patient are available. The reason why I'm saying this is before the patient, you need to do all these things before the patient will come. So make sure you lay the bed, you make sure you make quality bed, you make sure the IV stand and all other necessary things are already there. Then the next one that you are going to do, and it's you need to introduce yourself to the patient. And as a patient in the room, don't do that. That's wrong. You need to introduce yourself. Then you need to also make sure that you identify the patient by one, their name, their age, their hospital number, or their ID numbers. So you need to get to know all these things. And to be over, hi, Mame Mansa. Ebi awaba mame mansa me bacho what to say okay your friend me amoji Kelvin me na enei me ye nurse me cho edwaba surgical ward ha. So you need to do brief introduction to the patient. Why introduce you? Then you also identify the patient, because be a krana nipa na oba no be na anye kona eden esoba. So who you should the patient name, the age, and all other necessary requirements. Now you will be able to identify the patient. One will say, indeed, this is the patient the doctor has ordered to come into your ward for them, or for her to be monitored and as a so after you've done the introduction, you need to do a quick assessment. This assessment, you need to first check the vital signs. Mostly ABR patient already now, they have already checked the vital signs for the patient and all the. So the doctor will enter all those money now for you to see. But immediately the patient enters now, make sure you also do a quick assessment. You need to check the vital signs. Checking the pulse, the respiration, and all those money. You need to make sure you do this quick assessment before answer. Yes. After that, you need to orient the patient. You see the patient, hospital, and as be our new ward, so immediately the patient enters now. Why is a quick assessment in this animal? Make sure you orient the patient. So orienting the patient, you need to make them know where the maybe the toilet facility is, where they are going to urinate, where they can get water, where they can get food. Then you also brief the patient relatives. You need to let them know the rules of the hospital, the time they need to visit. All these are very important. Then the next one that you need to do, you need to also do physical examination. So under this physical examination, one, you need to do assessment, head to toe assessment. And so assessing the panel, head to toe. One, you need to check the skin condition. You need to check whether there's any deformities, any baby a pie, the baby a bra, your baby one home, the skin color no crack. So guys, the next one that you need to talk about is admission history. You need to know or get to know, say, patient, any admission history, then you need to check the medical history. Then you need to also check their social history. So then you check their allergies. Then also get to know whether I say be undergo surgery before and I say all those things. All these things are under the admission history. So then you need to also label their belongings. If be a patient in or the way by. So you need to label them. So if be a doctor now, they have given us some medications. If be a you need to label all those things. They came with be a clothes and other. You need to label them because you might not be there. If you are done with your shift, another nurse will come and take it from there. So you need to label all those. Then the next thing that you need to do for the patient is you need to start with the doctor's order. So after saying panaba, obedu wajeno, ojenu prepare bed amano. After say preparation of bed, what you identify, I introduce one channel, I establish a rapport near the I'm a patient. After that one, why assessment, maybe what take some quick assessment, the vital signs near the physical examination, every after physical examination, why orient patient, and I'm a patient in hospital, near my own baby as often at the moment. The next thing that you need to do at the SLB, we make sure say you start with the doctor's orders. Said we are doctor and say then money for infusion ways in so you need to start. Then the last thing that you need to do, and he said, Abusuya, please document whatever you've done for the patient. Document whatever you've done for the patient. Document everything that you are going to see on the patient because it's going to save you. Should in case there is any legal issue, it's going to save you. So Abusuya, this is what you need to do, or this is how we admit a patient into the hospital, or this is how you admit a patient into the ward or the facility. Thank you guys for watching. Keep on watching Kevin TV. I love you. Bye-bye.